My name's Tom Buchholz. I'm a radiation oncologist at Scripps MD Anderson, where I'm also the medical director of the Scripps MD Anderson Cancer Program. Many patients wonder when they're receiving radiation for treatments, whether radiation can actually cause cancer. Fortunately, this is very unusual for radiation to lead to a cancer development complication. It is clear, however, that there is a very small but true risk of developing what's called an angiosarcoma, or a blood vessel type of sarcoma that could develop within the radiation field. As I mentioned, fortunately, this is a very unusual occurrence, making it probably on the range of well less than 1% of all treated patients. Probably, while it's difficult to estimate the true incidence, it's probably more on the risk of like 0.1%. So a very, very unusual occurrence. And yet it's still appropriate that patients are aware of this potential risk. Radiation-induced angiosarcomas of the breast tend not to develop for many, many years after treatment, typically developing somewhere on average about 8 to 10 years after their treatments. When they do develop, they should be treated surgically. Unfortunately, it's a very aggressive form of sarcoma, and there is risk of distant metastasis, and there is risk that there might be a challenging surgery to perform. But nonetheless, some people with radiation-induced angiosarcoma can be appropriately treated with multimodality treatments and still cured of their disease. So while sarcomas are unusual risk, the good news is that radiation is really safe. There are some other normal tissue consequences that we think about. The most important during the course of treatments are some short-term radiation dermatitis. So there could be a period of time when the breast is a little bit erythematous, analogous to a mild sunburn. Again, most people tolerate this extremely well. There's also some short-term fatigue associated with radiation treatments. And then longer term, probably the most common side effect would be some minor change in the cosmetic appearance of the breast, or sometimes the breast can become a little bit tighter and more uplifted. It could sometimes cause some heterogeneity in appearance with respect to the other breast. It can sometimes become a little bit smaller. So a little bit of asymmetry in the cosmetic result. But well over 85% of people now treated with modern surgical and radiation techniques enjoy a good to excellent cosmetic outcome as well.